to share my screen. Oh wait, there it is down at the bottom.
Yeah.
And this, and okay. So today I'm going to be talking about how to take care of your feet and avoid complications related to your feet when you have diabetes. And so why do we care about your feet when you have diabetes, right? This is a sugar problem. So the reason we care about your feet is about a third of the people with diabetes will have some sort of diabetic foot problem at some point in their life. And with early identification and good healthcare habits, you can identify them early and prevent the risk of infection and amputation, right? That's what we're all kind of trying to prevent, is we don't want people losing toes and on up. All right. So the people who are most at risk for problems with their feet related to diabetes, if you've had a foot ulcer in the past, nerve damage in your feet, or any foot deformities, poor circulation, and then smokers. Those are the people who need to take extra care. Also, the longer you have diabetes, the more at risk you are, because a lot of the complications and the health conditions that lead to these complications are accumulate over time. So people with type 1 diabetes sometimes are diagnosed as children. So they have many decades of dealing with blood sugars and the potential for accumulating complications, right? So one of the things I do with my patients at least once a year is take a good look at their feet. And anytime someone tells me they have some problems with their feet, they know to bring them up to me during their visit. So it's part of our clinical care that people with type 1 diabetes, they should have annual exams of their feet beginning 5 years after diagnosis. It's a little different for people with type 2 diabetes. Often people with type 2 diabetes have had it for longer than they know before they actually get diagnosed. It's estimated that 40% of people in our country with diabetes don't even know it. So it can sometimes, that you can have had it for quite a while, which is why we begin annual exams right from the beginning. All right, so what is a foot exam? So a clinical foot exam involves looking at particular areas of your feet for problems. All right, and I think you could probably see, let's see my pointer here. So these little circles refer to areas that are more likely to have skin breakdown, okay? So one of the things that can happen with diabetes is you can lose the fat cushion that's between your skin and the bone. When that happens, then the bone can be rubbing directly against the skin and cause skin breakdown, which is also known as a diabetic ulcer, which we'll talk about more. So when I'm doing a diabetic foot exam, I'm looking at these areas in the bottom of the feet. I'm also going to check the pulses at your ankles and at the top of your foot, and look at your nails and your skin. Feeling for any cold areas or warm red areas, and calluses. These are the kinds of things that I look for. And I want to show you, I'm going to stop sharing for a minute here and show you some of the tools that I use. Okay, so this is called a monofilament. It's a little hard to see. It's basically, it's like a piece of fishing, like thick fishing line that we use. And we use this because we want something standardized to touch the bottoms of your toes and the bottoms of your feet with. And so it doesn't hurt. It's not stiff like a needle, but what I want to do is touch a spot on your foot until it bends slightly and see if you can feel that. All right, that's a way of testing whether those nerves are working to transmit sensation. Okay, so I'm going to do that in all those spots that were gray on the slide that I just showed you. The other tool I use is a tuning fork. All right, this is one of the cool things I get to use. So a tuning fork, it makes a vibration. And what I do is put the end of it on your, the side of your big toe, where the toe meets the foot. So I get it vibrating and then hold it against where the skin is thin on the bone, and you feel it vibrating. Now, I'm also feeling it with my fingers, and I'll ask my patients to tell me, first of all, if they can feel the vibration, not just the pressure, but the vibration. And then if they can, I'll ask them to tell me when they feel it stop. And I compare that to what I'm feeling with my fingers with the vibration, right? So it's not quite as precise as it's either present or not present. It's about how much of that time. Am I still feeling it strongly in my fingers when you stop feeling it on your foot? Or can you feel it all the way till I can't feel it with my fingers anymore? And that tells me about a different part of the nerve fiber that transmits sensation. Okay. And then finally, I'll use a reflex hammer on the Achilles tendon on the back of your heel, just to make sure you've got good reflexes on the back of the heel there. Okay, so let me go back to my slides here. Okay, so this picture here on the right is that monofilament with just a slight bend in it, so that people can tell me whether they can feel it or not. And I always have people close their eyes so they can't see which toe I'm touching and when, and have them say, yes, I can feel that, as I touch each of these different areas. Okay. All right, let's talk about some of the things that those common foot problems you might encounter. All right, calluses. So calluses build up where there's friction, and it's a thicker skin, and it can cause problems because that pad of thick dead skin can build up over where the bone is close to the surface on your bottom of your feet. And it can cause pressure on those areas. So the blood vessels and tissue are caught between this firm dead tissue and the bone. And it can cause death of the skin between those two things. So we like to keep those calluses softer. And so one of the things that a podiatrist does is you file that off in a way that will avoid an injury to the healthy skin around it, but remove that thick pad of skin. Now, you can help with this at home by keeping your skin soft by using thick emollient lotions after you get out of the shower or bath. Right. You have to be very careful if you're going to try to gently remove these by yourself, because you can do injury, and certainly causing bleeding and open skin can lead to infection. So the best course is to help prevent them from building up. And if you do have thick calluses, see a podiatrist to get them removed, and then make sure you're doing your maintenance to keep them from coming back. Okay. The rule of thumb for any skin on your feet is we don't want cracks or blisters or open skin anywhere, because that's an avenue for infection. Okay. Another common problem can be an ingrown toenail. So you can see that the edge of the big toe there is cutting into the healthy skin around the side of the nail. This can cause pus to develop. It can get infected, and it's usually due to not trimming your nails properly. So there's a couple ways that these can be treated. You can gently soak your foot for no longer than 5 minutes in some warm water. And again, the best treatment is to avoid it from happening by trimming your nails properly. And I'll talk more about that in a minute. Sometimes if this is a common recurrent thing that keeps happening to you, then what a podiatrist can do is remove about 1/3 of the nail on that side so that it grows back more narrow and doesn't cut into the skin on the sides. Sometimes as we get older, our nails, instead of growing flat or gently curved, will almost become cylindrical, almost like a tube. And it's just about impossible to avoid an ingrown toenail if your nails are like that. Okay. All right, blisters are another thing that can happen. If you don't have good protective sensation on the bottom of your feet, meaning that they're pretty numb, you can wear a blister on your foot without knowing it. That's one of the common things that happens with the loss of sensation, is you can get injuries that you're not aware of until they're more serious. So if you ever do get a blister anywhere on your foot, you want to protect the skin. You don't want to pop that blister or stick a needle in it or try and cut it off or anything if it's intact, even if it's quite firm, because that skin, when it's intact, prevents infection from getting into your skin. But sometimes they pop anyway, and that you have to keep it covered if that does happen. You can protect the skin, though, protect an intact blister with some stuff called moleskin. You can find that at the pharmacy. It's kind of like a thick felt with sticky stuff on one side. You cut it to the right shape so that it just allows, it prevents pressure onto the bottom of the blister, so that it's called offloading it. You don't want direct pressure on that blister to burst it. Okay. It also may be a sign that you need new shoes if you're getting a blister on the bottom of your foot anywhere, because that means that that's again a friction that's causing this irritation that causes fluid to build up under the skin. Okay, all right. Hammer toes. Hammer toes is another problem that you see, not just with diabetes, but as we get older, generally, you can get this, instead of your feet lying, your toes lying flat, straight out, you can get the joint that bends. And so it's very difficult to straighten it out. This is caused by a shortening of the tendon along the bottom of the toe. So it pulls it up. And then instead of the pad part of the bottom of your toe touching the ground, it's the tip of your toe that can touch. And that can cause two things. It can cause skin breakdown at the tip of your toe, or in the knuckle part, you can develop a corn, and because it's rubbing against the top part of your shoe. So, and that's another place that you may develop skin breakdown as a result of that friction. Okay. So one of the things we'll talk about a little bit later is diabetic shoes, which are built to help accommodate this kind of foot problem. All right. Fungal nail infections. All right, so quite often as people with diabetes will have fungal toenails. Now these are nails that are thick. They can be kind of flaky or layered, usually not painful, but they can be very difficult to trim when they get quite thick. Part of this is due to decreased circulation. Having diabetes for a long time can affect the tiny little blood vessels. And the farther away you are from the heart, the worse the problem can be. So your feet being the end point, the farthest from your heart, you may have poorer circulation, and the yeast fungus that causes fungal toenails thrives at lower temperatures. So it can start as a little yellow patch, and then it can progress and ultimately involve the entire nail. And the nail may lift off, it may be quite thick, and they're certainly very difficult to trim. They do make wide jaw nail clippers to accommodate that, but even with those, sometimes the nails are so hard they can be difficult to trim. So what I tell my patients is, if you feel tempted to go out to the garage to get something to trim your toenails with, it's time to go see a podiatrist who have the right tools to help prevent you from causing an injury to your nails. So they can use things that are kind of like Dremel, moto tools, the things that sort of erode the thicker nail away. They can use the thicker, the wider jaw nail trimmers. There's a variety of things that they can do. Okay, so as far as progression though, or danger, there isn't anything dangerous about them unless they cause an injury. All right, so it is a cosmetic issue and a injury prevention issue. This is one of the conditions where the cure is worse than the disease. So there are some things that you can do to try to treat toenail fungus, but for the most part, you're better off saving your money and going to a podiatrist to get them to debulk it, to get it smaller and trim them for you. The topical things that you can put on, like nail polish, are not very effective. And again, you could save your money on that. And then you can use an oral medication, but you have to take it typically about 3 months, and it can be very hard on the liver, right? So that's what I mean by the cure being worse than the disease, that it's generally not worth it, in my medical opinion, to try to treat it with a medication that may cause you liver problems. One of the things that podiatrists can do if you really want a permanent cure is that they can remove the entire nail and then treat the nail bed with the topical things, and that sometimes can kill the fungus. And then the nail can grow back or not, only time will tell. But that's really the only proven and safe cure for a fungal toenail. Okay. All right, so diabetic foot ulcers, these are the things that we really want to do everything we can to prevent, because if you have neuropathy to the point where you don't feel the bottom of your feet very well, you're at high risk for injury to the bottom of your foot, especially in areas where the bone is close to the surface of the skin. Those places that I showed that we touch on with the monofilament testing. So what can happen is you get skin breakdown that causes an open wound, and that's an avenue for infection. And the reason later we're going to talk about daily foot inspection is to catch these problems before they become too bad, because if they become deep enough, this can actually infect the bone, and that is quite likely to lead to amputation. Okay, so the one on the right here is under the head of the metatarsal. So it's a rounded area that's at the base of that toe, that where the bone doesn't have much padding underneath it, and it causes that skin to break down. All right, and then the heel's another area, and those are the two most common areas by the toenail, by the great toe as well. So again, this is something that can cause a lot of problems, and it's best caught and treated early to prevent amputation. All right, and then finally, another type of rare but potential problem has to do with long-term diabetes, and damage to the nerves can cause a collapse of the middle part of the foot. So here on the left is a normal arch of the foot. And then here on the right is that collapse of that foot. You can even have a broken bone in here. And then you can see the area that is now pushing down on the bottom of the skin here in the midfoot, and it's possible to get a foot ulcer there. So the bottom of the foot, rather than having this sort of typical footprint shape, becomes quite wide and flat. All right, sometimes it's called rocker bottom foot, but there's high risk for skin breakdown right there. Sometimes it's painful, but often it isn't. And I've had people tell me they were just walking and their foot just suddenly wouldn't bear their weight on it. And they go and find out that this whole middle part of their foot has collapsed. Okay. So it's, again, something we're trying to avoid. They can do surgery to put pins in this to try to stabilize it, but it can be debilitating and cause a lot of problems walking with at times for people. All right. Oh, I guess there was one more. Circulation issues. This is not particularly just a foot issue, but it is can lead to foot problems. So as I said, that the high blood sugars can be toxic to the tiny little blood vessels and nerves, and the feet and lower legs are more prone to these problems because they're farther from the heart. So when you don't get enough circulation, then the skin on the surface of your legs can die or be very affected. One of the earliest signs is these bulging veins, and also loss of hair. So if you used to have pretty hairy legs and hairy feet and toes, and you're noticing less and less hair, that's a sign, an early sign of some circulation issues, because the hair follicles won't grow if they're not getting enough blood. Okay. That swelling can also be a product of these circulation issues. So your veins all have these little valves in them, so that as your heart pumps the blood, it pumps it up, and then the valves keep it from falling back down again. So with each beat of your heart, it's pushing that column of blood up again and keeping your blood returning back to the main part of your body after it's been down to the bottom of your foot and you want it to go back up again. Swelling is when those vein valves stop working quite as well, and it allows more of the fluid to return back down to the bottom of your feet. And again, that pressure can cause skin breakdown and lack of hair growth on your lower legs. And we can get that what's sometimes called brawny discoloration, or this brownish coloration on the legs. That again is also a sign of poor circulation, and it's a risk for skin breakdown, meaning skin ulcers that have a hard time healing. All right, so now that all that bad stuff's out of the way, let's talk about what we can do to see if we can prevent some of these from either from happening or from worsening. Okay, I thought that was fast. Don't let your dog do your foot care for you. So what we need to do is take a look at your feet every day. If it's difficult to see the bottom of your feet, here's an example of someone using a hand mirror. Other things you can do if you have a wall, a full length mirror, you can sit in front of it and lift your foot up so that towards it so that you can see the bottom of your feet. But it's a good idea to look at the bottom of your feet every day, particularly if you have neuropathy. I've had people come in with pins or tacks stuck in the bottom of their feet that they didn't know about, or tell me that they didn't know they had a problem with their feet until they saw blood in the shower, right? You don't want that to happen to you. You want to know if you've got any little cracks between your toes or anything stuck to your foot, any blisters, anything that's going to need some attention. You should wash and then put moisturizer on your feet every day. Never walk barefoot. Even at the beach, you should wear sandals because you could step on something that could injure your feet and cause a problem down the line. All right, so your shoes, you want them to be well fitted with lots of room for your toes. And then of course, managing your blood sugars. We have lots of tools in our toolbox now for helping control blood sugars, not just insulin and metformin. We've come a long ways in the last 12 years or 15 years with some very tolerable and medications. One of the things that I always work with my patients to do is find things that are effective, tolerable, and affordable. So if you haven't had your diabetes management changed in a while, you may want to talk to your doctor or see an endocrinologist about some of the newer options available. Smoking, again, is another risk factor because smoking also affects your circulation. So if you're a smoker, cutting back and quitting is something that'll help prevent foot problems. All right. So this is just another example of looking for problems on your feet. Sore spots, cold spots, lumps, bumps, tender areas. Put a mirror on the floor, or if you're as flexible as this lady, you can bend the bottom of your foot up so you can look at it. But I know that's getting harder for me as I get older. So looking at your shoes, making sure there's nothing that might cause an injury to your foot is important. Okay, so here's some more information about the things you're looking for in diabetic shoes. These just an example of one type of shoe, but basically you want something that has plenty of room in the toe box so that you don't have any squeezing or causing your toes to rub against each other. Something with a good amount of padding on the bottom, non-slip bottom, wide base for stability. So Medicare will pay for diabetic shoes. So you just need to have an order for them. Something that I find ridiculous is that as a nurse practitioner, Medicare doesn't allow me to write a prescription for diabetic shoes. So I have to work with a physician to get those orders signed. It's pretty ridiculous, but I can write for insulin and all kinds of treatments and tests and things, but not shoes. But anyway, it's just a silly Medicare rule. But their podiatrists can start the order for them, or your family physician or endocrinologist all can write a prescription for shoes, and Medicare will pay for one pair a year for people. Okay. All right, when you're trimming your nails, so the shape is really important. You can see how in the picture on the right, this incorrect one, as this nail grows out on the sides, it could dig into the skin there on the side. So you want to let them grow out till they're past just barely past the end of where it meets the skin, and cut them straight across and use a nail file to just slightly round those edges so there's nothing sharp to catch on your other toes. Okay. You don't want to push down on the cuticle, which is this part down here. That's where the new growth is happening, and you can injure that cuticle bed and cause problems and increase your risk for fungal toenails there. So, right. What about pedicures? We had a question not too long ago about pedicures. Is it okay to have a pedicure when you have diabetes? And so I looked up the guidelines for this, and the main thing is you don't want to soak them for more than about 5 minutes. 5 minutes or so is okay, though. You just don't want to let them stay in there till your skin is all wrinkly and easier to cut, right? Make sure you tell the pedicurist that you have diabetes. Look for the licensure. So people who perform pedicures do have to be licensed by the state. If they are not, you should ask about where their licenses are, but they should be prominently displayed. And again, you don't want the nails trimmed too short. You want them trimmed straight across and just gently, or just, rounded slightly at the edges, no extreme angles that might cause an ingrown toenail. And again, no pushing back of the cuticle or trimming it. I know sometimes I've had pedicures where they sort of cut down the side of the nail and then pulled out that little piece that they cut out. Don't let them do that. That is a high risk for both an ingrown toenail and for an infection.
Elizabeth?
Yes, I think I see we have a question.
Okay.
What is it? I haven't actually looked it up.
Okay. Can your PCP order diabetic shoes?
So the rule is that the person who is managing your diabetes can order shoes. So yes, your PCP can order diabetic shoes for you.
Do they have to be identified as a diabetic shoe? I mean,
I think what the way that it usually works is you take that prescription or the order to a medical supply place that provides shoes, and then they will fit you and make sure that you're getting the proper fit. It's possible other shoe stores would do that, but I don't know that for sure. I do know that the medical supply companies will do that fitting for you, because you want to make sure that it's the right length, the right width and depth, and so that's an important feature. So yeah, I'm not sure about the anywhere else. Okay. All right, and let's see. So we talked about pedicures. So a lot of people will get pedicures instead of going to a podiatrist, because not all insurance will cover podiatry, and even Medicare, if you don't have any signs of neuropathy on clinical exam, they may not cover podiatry services. Medicaid does not cover podiatry no matter what. So it can be outside people's budgets, and pedicures can be more affordable, and they're not a bad option. They really can do a good job. You just want to look for a place that is licensed, and make sure you tell them that you have diabetes and they should take extra care with your feet.
Someone is asking now what medical supply companies are in Charlottesville.
That's a good question. I can Google that at the end, but I know we've got at least a couple of them, but I'm drawing a blank right now.
I know there's one place out on, I want to say out on 29 somewhere, but right now it escapes me.
Yes, I'm thinking that too. So my advice would be to Google it and look, but I know there's one. I know there's at least one here in Charlottesville. So yeah, sorry, I don't have it off the top of my head. All right, the podiatrist.
Now someone has a question asking, okay. Where do you get your pedicures? Who do you recommend?
Uh,
I don't know
I
if we
don't
can
get
do that.
pedicures. I don't get any pedicures myself. Recently, I had one done at the beach a while ago, but it's not something I do regularly.
Right.
So I'm afraid I don't have any recommendations other than the kinds of things you should be looking for. So ask around for friends who've had good experiences.
I don't think we could medically necessary, because they're not medical treatments.
Correct.
So
Yes.
we
Yeah.
probably can't recommend, medically speaking, we can't
Right.
recommend.
Yes.
But
Right.
yeah, if you have a good friend or a family member who's seeing someone who does an excellent job, and they're really good, and don't cause any kind of injuries, then
Right. That's correct. Yeah.
so anyway,
Another one, maybe? Do I see another question?
it's directed to me. I'll deal
Oh,
with
okay.
that one.
Okay.
Thank you.
All right. So podiatrists. So we have a number of good podiatrists. Atlantic Foot and Ankle is a practice that has many locations in our area, and the podiatrist will go around between different practices in Culpeper, and there's some other ones around. Like I said, Medicare will cover nail trimming services as well as treatments if you have neuropathy. And then I think they cover it every 3 months, nail trimming services. But they can also, if you have any foot related problems, they can do wound care, they can do surgery. Podiatrists can do surgeries, they can do amputations, or they can do treatments that can help save your circulation. And we also have vein specialists who can put stents in blood vessels if they're getting occluded and causing circulation issues. And they can also fit you for and provide diabetic shoes, some of them, but there's a number of good podiatrists around. So the podiatrist, you get a visit with the actual podiatry doctor, and then the nail trimming services are usually done by podiatry technicians. Right. All right, let's talk a little bit about neuropathy. And I get a lot of questions about this. It's one of the more difficult to treat aspects of foot-related problems with diabetes. So it can take a number of different forms. So sometimes I can feel, I can uncover that people don't have good vibratory sense, or they don't have good sensation on monofilament. But sometimes your foot exam may be normal, but you're feeling sensations of pins and needles, burning pain, a tickling problem. And it can be worse at night, and it can be very challenging to sleep if you have severe neuropathy. So usually it'll start with your feet, and then it can progress up further. People can also have it in their hands. It often is due to diabetes, but other things like chemotherapy and some other medications can cause neuropathy. And like I said before, that the higher blood sugar readings can be toxic to the little nerves and blood vessels. And then the nerves sort of are overreacting and sending these false pain signals up to your brain. So it can be quite debilitating. So burning, electric shock, tingling, numbness. And I put in here as well the goal for your blood sugars. We're looking for your fasting blood sugars, that's in the morning before you've eaten, to be between 80 and 130 for most people. And then if you're checking your blood sugar after eating a meal, you know that meal was kind to your blood sugars if your blood sugars stay less than 180 after eating. Okay.
Elizabeth, someone
Yes.
is asking, what do you mean by false pain? The pain is real.
I guess it's a false signal of of injury, so that it's giving you pain is a reaction to a stimulus typically. So if you touch something hot, it causes pain and it makes you react. But with neuropathy, there is no injury typically. It's just the nerves are sending the signal as if something is, stabbing your foot or burning your foot in the absence of the actual stimulus. The pain is absolutely real because that your brain is perceiving it as real, but it's a false signal is probably what would be a better way of saying it. All right, because usually the pain is designed to help protect us, but in this case, it's not a reaction to a painful stimulus, if that makes sense. I hope that makes sense.
Okay. I have a question. Mm-hmm. Does having neuropathy from not related to diabetes, like such as chemo neuropathy, which I had chemo in the past, and so now I have neuropathy in my hands again. So I was just curious, is that considered like a risk factor for diabetes? Or I see you state here it can make your blood sugars higher.
No, it's more that it can result from higher blood sugars. It doesn't make your blood sugars higher. Okay. No, it's but the neuropathy, no matter what its cause, can respond to the same medications and treatments, which we'll talk about in a moment.
Okay. But
no, it's not an independent risk factor. Sometimes chemotherapy is used along with steroids to help avoid the side effects, particularly nausea, of the chemotherapy agent, and that can raise your blood sugar. And in people who are already have a little prone to diabetes, it can cause high blood sugars. Okay.
Thank you.
All right. So there are some modifiable factors that it can help prevent the neuropathy, but even with best glucose control, not smoking, and being a healthy weight, sometimes people do still end up with neuropathy. So we want to do everything we can to modify the risk factors, but sometimes despite our best efforts, people do end up with neuropathy. So it's certainly not a judgment on how you've been doing or a punishment of any kind. It's just an unfortunate result from having diabetes for some people. So there's some medical treatments we can use. I'm not going to cover absolutely all of them, but I just wanted to make you aware that there are treatments for them. There's some medications like Cymbalta. Cymbalta is also used as an antidepressant. That's how it started its life, but it was found to help with all kinds of pain. So chronic back pain, even headaches, and as well as neuropathy. So when I'm looking to choose a medication, I like looking at if there's any way that the medication can help address more than one issue. So if somebody has depression and anxiety and neuropathy, then Cymbalta might be a good option to try because it's going to help address more than one issue. Gabapentin is probably one of the most commonly used agents for helping with neuropathy, and it helps damp down those pain signals from your nerves. Sometimes it makes people drowsy, not always, but it can. And if it does, and your neuropathy is worse at night, then that's great, right? I mean, it helps both you, helps you sleep well and helps with the neuropathic pain. All right. And then there's Lyrica, which tends for most people to make them less drowsy and work similarly to gabapentin. Both gabapentin and Lyrica started off as anti-seizure medications, but also were found to have good effect on nerve pain.
Someone has a statement about gabapentin.
Yes.
Stating gabapentin cause gabapentin, I think it means causes memory loss when abused, but it can also lead to other cognitive problems that can contribute to memory impairment. I guess this is a personal experience.
I think that it also can be something that it's a listed side effect. It isn't common, but it is something that it can cause.
Mm-hmm.
We all wish we had treatments that were 100% effective with zero side effects, but we don't. So whenever prescribing a medication, it's good to know and talk with your provider about what are the potential side effects and why are you choosing this agent for me and what are my other options. It can work well for some people, but other people it's not a good choice, and sometimes we have to do trial and error, which is the hardest part, I think, about medical care is we do our best with the evidence we have at our fingertips and hope to never cause anyone harm. So some non-prescription treatments that you might try, capsaicin cream. Capsaicin is based on red pepper. This treatment is based on the gateway theory of pain control. So interestingly, your nerves can't carry more than one strong signal at a time. So if you are using capsaicin cream, which causes warmth, it's a sensation of warmth to your feet, then that pain signal may not be as strong. Some people find it intolerable. If the way that your neuropathy manifests is burning pain, then absolutely don't use this one. It's only going to make it stronger. But for some people where it's tingling, the capsaicin cream causes a sensation of warmth and it can distract from the tingling sensation. With any topical, you want to make sure you don't ever put it on broken skin. Your skin should be intact. So something that you might consider trying. And then alpha lipoic acid is a supplement that has been studied in peer-reviewed studies that compare it to placebo and found to be effective. It's an antioxidant. So the typical dose recommended is 600 milligrams daily. And I've had some patients who had some success with this. As you've probably all seen, there are many ads and treatments that are recommended for neuropathy. I would be wary of them because there really isn't anything that has yet been proven to reverse neuropathy. If you've had neuropathy for more than a year, it's unlikely that it's ever going to go completely away. That's a harsh statement, but that's the reality of it. We can do things to try to treat the pain, but as I said, nothing yet has been scientifically demonstrated to reliably reverse neuropathy, which is all the more important to try to avoid it as much as possible. All right, so I didn't mean to end on such a somber note there, but I would like to thank you all for inviting me to come, and I'd be happy to answer questions that people have at this time.
There's another chat question. Have you ever heard of METANX, Metax? This was prescribed by my podiatrist. METANX.
METANX. I have not heard of that one. So if your podiatrist recommends it, it may you can give it a try. I would ask how it's been studied and what the results of that study were. Just to see what the evidence, evidence shows. So in my line of work, I'm hesitant to prescribe or recommend anything that has proven to be effective in most people who try it.
It's a B vitamin folate. They say it's a B vitamin folate.
Oh,
Very
okay.
expensive, and Medicare will not pay for it.
Yeah, that's always the drawback with these there's a couple drawbacks to non-prescription treatments. The first is they are not required to be studied. So if they're a supplement, they are regulated under the FDA as food and not as medicine. So they don't have to meet any of the same criteria that medicines do for safety and efficacy. So they tend to be expensive, and it's the research is not always, it's not there the same way that medical treatments are.
Another question, is discoloration of the toenails a sign for diabetes?
So by itself, I wouldn't say it's a sign of diabetes. So there are some things that can happen with the skin that are indications that you should get your blood sugar checked. Like you can get a dark discoloration on the skin around the neck, blurry vision, frequent urination, having to pee all the time, being very thirsty. Those are signs of diabetes. But if you're asking, is it discoloration a sign of foot problems related to diabetes? It could be. So if you haven't injured your foot and there's a purple color underneath the nail, then that could be a sign of poor circulation to that toenail, and something to keep an eye on.
Any other questions? It's now or forever hold your peace. Let's see. Okay, go ahead.
I have a question.
Uh-huh.
Why would you have brown spots under the bottom of your feet?
So brown spots, if they're new, they could be moles or that can pop up, or even it can be a sign where skin cancer can show up. Not to, I don't mean to scare anyone. It could be a circulation issue, but if it's a new and getting bigger spot on the bottom of your foot, you should probably get someone to take a look at it. Okay. Most commonly, it's probably what we call an age spot, which is just extra melanin under the skin, or it could be an injury or poor circulation. So, but as a healthcare provider, I always want to make sure I don't miss the worst case scenario. So sorry if that was scary, but it's something to get looked at if it's new. If it's been there forever, it might just be a mole that you've had there for a while.
Okay.
Another from the chat box. You said loss of hair is a sign of diabetes. I no longer have to shave my legs and has very little hair under my arms.
So it can be related to poorer circulation. Now we all our circulation declines as we get older, all of us, right? We get thinner hair everywhere. But if you have diabetes, then you might, especially if you're having pain or neuropathy in your feet, you should talk to your healthcare provider about that, because it could be a sign of decreasing circulation in your legs.
Mm-hmm. Any others? If not, I want to thank you, Elizabeth. You've done a very good job tonight and very informative and useful, helpful information for all of us. Another pop-up from the chat. What can we do to increase circulation? I know that.
Good question.
Move
Yeah,
around.
I didn't talk about that. That is a good question though. So is particularly if you get swelling in your ankles, so getting up and moving. So the worst position to be in if you have poor circulation and swelling in your legs is sitting, because you've got two right angles, right? You've got your right angle at your waist, your right angle at your knees. And that is a pinch point for your blood to return back up to your body. And so it can pool in your lower body. So sitting for more than an hour at a time is definitely a risk factor for poor circulation. So get up every hour. You know, if you're watching TV in the evening, get up every commercial and just walk around the room a little bit and then sit back down again. If you're traveling on an airplane, you know, get up every once in a while. If you're driving, stop every 2 hours and walk around. If you get a lot of swelling in your legs, lift your legs up. So, you know, sit on the couch with a pillow under your knees so that your feet are higher than the level of your heart. That helps gravity move that fluid back down to your into your body and prevents that pressure of the extra fluid in your lower legs. So moving is always the answer for circulation.
Someone else says, what about laying on your back for 20 minutes per day with your legs up on the wall? So
that's not going to hurt a thing unless you, yeah, I mean, I think that's a good idea. That's, but it's still not going to counteract, you know, the other 10 hours sitting up, sitting in the chair, right? So it's, that also uses gravity to help return that extra fluid to your legs. So that's a good thing to try.
Okay. Here's another question, and I'll just let you guys know I've got 4 minutes left because I have to get off of Zoom by 6:05 because there's another one scheduled. But I appreciate all of the great questions you all are asking. But what if you don't get swelling, but your legs hurt?
It can still be a sign of poor circulation. So especially if your skin is cool and you're losing hair. You used to have hairy toes and you don't anymore, and you can only walk for about half a block and then you have to stop because your legs are hurting. That's a sign that there could be a little blockage starting in the veins in your legs. And we have excellent vascular surgeons here who would be happy to take a look at you. They can do some simple tests to see if you would benefit from a stent, which can really open up that circulation.
Mm-hmm. One more. Have you heard of brushing the legs?
Brushing. I'm not sure what that means. So, you know, massage is going to, of any kind, is going to help increase circulation, right? Because it's bringing the warmth and, you know, friction to the legs. So, massaging the legs and feet every day is probably a good idea, but I'm not quite sure about, I don't know what brushing refers to.
Someone says, thank you for very good information.
Oh, you're welcome. Thank you for inviting me. This has been fun.
Yeah, I have to tune off now. I see my message coming up here. But anyway, thanks for a great talk, and I appreciate your great attendance and everyone who chimed in tonight. And if you have any further questions, you could send them to me and I will forward them to Elizabeth.
Okay, sounds
Thank you
good.
all.
All right,
Great
thank
night.
you.
All right, bye-bye.